Welcome to the First Bill. My name is Katie Meyer, and I serve as the VP of Education at APHA, and I'll be the host for today's episode. In part one, we covered two new therapeutic agents, gefotidacin and lenacapavir, how they compare to current therapy, and important education points to discuss with your patients. Today, I'm delighted to be joined by Jen Cocohoba, a clinical pharmacist scientist with research interests around medication use in people with HIV, interventions to improve adherence, and pharmacy-based programs to improve the care of people with HIV. Jen will discuss barriers to adherence and strategies that she has observed work well to overcome those barriers in practice. As I said, Jen, I'm really excited to have you here today. Welcome to the First Bill. Before we start, could you please introduce yourself to our listeners and share a bit about your practice setting and experience?
Absolutely. So first of all, thanks for having me. It's a real pleasure to be here with you today. In my current position, I'm professor of clinical pharmacy at the UCSF, University of California, San Francisco School of Pharmacy, where I also have served as the clinical pharmacist for the UCSF Women's HIV program for more than 20 years now. As of late, I've also been working really closely with our new UCSF outpatient pharmacies and really serving as a resource as they launch their pharmacist led prep program. So that's been a lot of fun as of late.
Awesome. Thank you so much, Jen, for that introduction. So as I mentioned, I'm aware of your research interests. These include medication use in people with HIV and things pharmacists can do to improve care of people with HIV. So first question for you, what have you found to be the top few barriers to adherence to antiviral regimens in people with HIV?
I mean, it's changed quite a bit over the years. Previously, we had really complicated regimens for the treatment of HIV. And I think one of the top barriers to adherence was simply the characteristics of those regimens. When I first started training and practicing in HIV, there were some regimens that were literally 8 or 9 football sized pills that you had to swallow twice a day. And as you can imagine, with these complicated regimens, there were a bunch of untoward side effects, things that are not pleasant, like nausea, diarrhea. We've come a long way since then. Regimens are much simpler. We have a number of single tablet regimens. There are some people that are eligible for 2 drug single tablet regimens. So we're even treating people with fewer medications successfully. Not everybody, but some people. So I think we've just made this movement to simpler and more tolerable regimens. And it's not that we don't have adverse effects. We certainly have adverse effects still, and people still need to find the right regimen for them. But they're different. So we're seeing emergence of newer adverse effects. We're trying to wrap our hands around, like weight gain and the metabolic disturbances. But I think really what I've observed in my practice is that the barriers are more logistical as well as personal, and the personal barriers have been in existence for a long time. My folks, the wonderful women that I see in the women's HIV program, they have a lot of medicines. They're busy with life, so polypharmacy can be a huge barrier to adherence. It's getting to the pharmacy, and not all the medicines are ready at one time, and so they get a text message saying your medicine's ready, but it's only 1 out of 5 that they need. So it's confusing, and it becomes work to make sure that you have all the medicines that you need to treat not just HIV, but all of your health conditions as well. So that is a challenge, a practical challenge for many of my patients. Even thinking about our newer long acting medicines, our injectable long acting medicines, they're fantastic for removing the need for every day having to take your HIV regimen. And they also require you to come for your appointments to make sure that you actually get those injections from the clinic or the pharmacy or wherever you're getting them on time. So they're very helpful from a day-to-day at-home adherence perspective, but you still have to work in other pieces to ensure that you're getting your medicines. And I think the last thing I'll say is that in my observation, while some people they're happily living their fullest and most vibrant lives with HIV, there are still a number of people who've had experiences that are causing them to hold and carry HIV related stigma around. And it's different for every single person, what their experience with the virus, with life, how those interact are. But for those folks who taking medications every day is a reminder of having HIV and all the things that are associated with it, I still think that remains one of the biggest barriers to adherence, period.
Thank you, Jen, so much for providing that insight. It's funny, I remember from many years ago myself treating those patients with those complicated 4 or 5 drug regimens, and that perspective is really true, right? So there's still barriers. They're just much different than they were back in the olden days, as they say it. Considering the barriers of today, can you provide a few examples of maybe pharmacy workflow models or things that you're aware of that pharmacists are doing to help reduce some of the barriers that you've mentioned for these patients?
Yeah, I'm completely biased, right? Because I practice in HIV and, hold my HIV pharmacy colleagues in high esteem. But, the first thing that comes to mind are what I think of as our HIV heroes in community pharmacy. They're on the front lines, right? And we still have those pharmacies that are going that extra mile to provide adherence packaging, those funny little bubble packs that my patients proudly tote to clinic to show me how they organize their multiple medications. That still remains very helpful because, again, even though HIV treatment has simplified, you still have to take it with all of your other medicines. So that adherence packaging service is still really helpful for a lot of my patients, especially as they age. We all know that the population of HIV, a population of persons living with HIV, is aging. So when you age, you then, luckily or unluckily acquire more comorbidities, which then means more medicine. So any support that people have in organizing their medicines, I think is often very welcome by people. I also think about this is sort of a side effect of the adherence packaging is that for those pharmacies that are providing those bubble packagings or other packagings, it also comes along with automatically synchronizing their medications. And so some pharmacies will provide MedSync programs independent of providing adherence packaging, but medication synchronization is huge, again, for that problem of I need to go to the pharmacy 4 times to pick up all the medicines I need, then reduces that burden of trying to get your medicines to just 1 time a month. Or, if you're very lucky and you have your insurance will allow you a multiple month fill, once every 3 months, or mail order, whatever it is that can decrease the work of having to actually acquire your medications. And a lot of the times it is our frontline community pharmacists that are still doing all of that background work that a lot of times people don't see. Prior authorizations to make sure people remain covered for their medicines. All of these are not inconsequential. They're so important for continuity of care. So, the lion's share of that work is done, I think, in our community pharmacies. But I think it also is, that continuum of care that we have across many disease states. We see that in HIV as well. We've got our community pharmacists that are connected to our HIV ambulatory care clinical pharmacists who are working with patients to select optimal regimens and, mitigate any drug-drug interactions. And then for our, patients that are diagnosed with more severe stages of illness, in the hospital, we've got our infectious disease pharmacists and our HIV specialized pharmacists in the hospital setting too, that are again ensuring people actually get on antiretroviral treatments. So that whole continuum, I think, is really super important for ensuring that our people that are living with HIV get the highest quality pharmacy care. But I also really love the innovative programs that are happening across the world and also the United States. So seeing our pharmacies and pharmacists are really pushing the boundaries, providing a long-acting HIV injectable treatments in alternative administration sites, meaning the pharmacy giving these medications inside pharmacies. It's not always easy. There are a lot of logistical issues to consider and financial repercussions, staffing considerations. But there are pharmacies, a few pharmacies that are out there that have figured it out. And they are doing it because they know that providing these innovative services can help patients access their medications, period, access them better, access them easier. So there's plenty of room, I think, for innovation in this space as well to reduce all of the barriers that we know are still in existence for people that have to take medications for chronic disease.
Awesome. Thank you so much for that, Jen. All great examples, and it's exciting to hear and, just acknowledge all the good work that pharmacists are doing day in and day out for these patients. So our last episode, we discussed recently approved lenacapavir. So how do you see this agent impacting treatment and prevention in persons with HIV?
Yeah, I think from a treatment perspective, because for lenacapavir subcutaneous injectable was approved for treatment a couple of years ago, but only recently got approval for HIV prevention. So in the treatment landscape, it's already made an impact. I think for persons who have multi-drug resistant HIV, a lot of resistance mutations, any agent that has activity is a welcome addition to the armamentarium of possibilities for crafting regimens that are going to be effective in keeping people virally suppressed, keeping their immune system strong. So I think lenacapavir has already made an impact there. Even aside from the fact that it is a twice yearly administered injectable, its activity, its novel mechanism of action has really helped us craft regimens for people where it was really difficult to create a regimen that was going to be effective versus their highly treatment resistant virus. So that has already kind of made its way, I think, into treatment. But I think the community is very excited. The healthcare provider community as well as the patient community is excited about the potential for using lenacapavir as a HIV preventative agent for multiple reasons. Obviously, the low frequency of injection means a lot, for people being free from commitments to have to come, only twice a year to receive an injection that gives them the confidence that they're protected against HIV. That is, I'm not sure, when I first started in HIV, if I would have imagined that we would have reached this day, something like that. I think there's a lot of implications too in terms of the studies that helped for the approval for lenacapavir for prevention of HIV were impressive, right? The low rate of HIV infection, 0 in the study for young women, and low number of infections in the follow-up study for gender diverse persons and men who have sex with men. It really lend confidence that this medication is going to be very effective for HIV prevention. So I think there's lots of reasons to be excited about lenacapavir coming to the stage for HIV prevention.
Do you have any kind of last parting words or recommendations for our listeners today about how they can improve access to lenacapavir?
Yeah. I think first and foremost, pharmacists are in such an amazing position to provide education and education to people on both sides. So, educating healthcare professionals about the different treatments that are available, about the different preventative modes for preventing HIV that are available. We just hold a lot of knowledge. So, there's an opportunity to interact with our colleagues to ensure that they have the latest information about all the treatment and prevention modalities that are at their fingertips. But also we're patient facing as well too. So you have the opportunity again to share that information about choices, because we're in an era now where people have choices, particularly around HIV prevention. So, how do I choose? Patients want to know, what is the best option for me? And so pharmacists can really help in that shared decision making framework help people select a regimen, whether it's oral daily tablets for HIV prevention, if it's intermittent HIV prevention prophylaxis, or it's an injectable, whichever injectable it is, really providing people, empowering them with the knowledge to be able to compare those treatments to select one that's right for themselves. So I think, pharmacists have the opportunity to really step up to the plate, educate themselves so that they can educate others. But then there's also just the practical stuff, right? Ensure that's what we do as a pharmacist. One of our primary jobs is ensuring people have access to the treatments that they need. So really understanding the payer and reimbursement landscape for long-acting injectables. This is not new to us, right? We went through this with long-acting injectable antipsychotics. There are other, novel PCSK9 inhibitors as well. But we're in an era of long-acting injectables, and I feel like the rules are fluid around how we get those covered and how people get access to those. So again, we have to educate ourselves. How do people get these medicines? What are the ways pharmacists can advocate for those? Whether it is learning how to do clinic processes for, long-acting clinic administered medicine authorization. That may be new to some of us, or understanding that not everything goes through the pharmacy benefit. Some things have to go through the medical benefit. Or we need to understand those to be able to inform and direct patients on how they can access these medications. It's both of a lot of it is around education. It's educating ourselves, educating others, educating patients, and really ensuring we have all of the novel and new pieces that are evolving, even spilling into the advocacy landscape. There are bills, state bills, pieces of legislation that are passing that will have influence on how people access HIV prevention treatment. So, on the immediate level, making sure our colleagues and our patients are aware, but also keeping an eye on the policy landscape and how changes in policy can impact people's access to medications. I think it will be important for pharmacists to ensure that we show up at the table when it comes to policies that are going to influence how our patients receive these treatments.
Absolutely, Jen. Thank you so much for just joining us today, sharing your experiences and recommendations for pharmacists. This has really been a thoughtful and inspiring look at how pharmacists can help lead the way, really, to improve outcomes in HIV care. All right. Well, let's summarize major takeaways from our time here today. So, as the transition to a more simplified regimen in persons with HIV has occurred, common barriers to adherence to antivirals in HIV care are now more logistical and personal, with polypharmacy and the practical aspects of keeping up with multiple medications from the pharmacy being one of the barriers. Additionally, long-acting injectables are helpful, but it still requires scheduling and some coordination to ensure that you remain adherent to the therapy. And then lastly, lived experience causing HIV-related stigma continues to be a major barrier to effective care. Community pharmacies are going the extra mile to provide adherence packaging for patients with polypharmacy, medication synchronization, and ensuring that coverage for these medications is attained. Additionally, pharmacists are pushing the boundaries and providing long-acting HIV injectable agents in the pharmacy for persons living with HIV every day to support easier access to the medications. Lenacapavir has made a major impact for treatment for HIV and specifically MDR HIV already, and because of its novel mechanism of action, it's available in many regimens today. For HIV prevention, the low frequency of injection is a major benefit, with impressive study outcomes that led to its approval. Pharmacists can provide education to healthcare professionals and patients about the different medications available for prevention to empower them to make the best choice through shared decision making. All right, folks, that's all I've got for today's episode of The First Fill. I want to again thank Jen for joining us today, and then also mention that we do have a full certificate program on pharmacy-based HIV PrEP services, so definitely check that out in our learning library if you're looking for more information. And then, as always, don't forget to visit the Learning Library at learn.pharmacists.com to ensure CE credit for this month's podcast. Thanks so much and take care.